What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video we're covering how the X-ray field slowly corrupts you over time. So now being on the side of the actual photographer, and I've gotten to witness other people from the beginning to a few years deep and how their career or how their ambition, like, it's funny because, like, I was there and you were there, or you're currently there. You go into the X-ray field, or to any field, to be honest, because my lady's a nurse, and you slowly, and I talk to other people, slowly get corrupted, and you don't even know it. It just slowly over time. Imagine you have a little cup of water, and every single day it drips of patients that come in. They're mean to you. They say mean things to you. They disrespect you. Your equipment doesn't work at work. The image system is down. PACS. There's an update. Like, slowly stuff that happens over time. Just slowly it happens over time. Eventually, you get corrupted. That's the sad part. It happens to everyone. I've witnessed people come in and they're all like hopes and dreams and stuff, and they come in. Oh, I was there too. I've recognized it. I've paid attention. I've took a moment to reflect on myself and to know that I've been corrupted because of the day by day stuff that happens, and it's just people are over it. You can easily, if you're a student going anywhere, just pay attention. Pay attention who's the new tech. Pay attention who's been there longest. When I was a student, I was fortunate enough to work at where I was a student training, and I paid attention. And I'm like, okay, I'm here with this veteran tech. How he does it? Homeboy would go in there, place the board in and out. Patient would be like, straight business in and out, and I would be like, why are you being so mean to the patient? The patient asked you for this, or why da. And he looked at me and he's like, look, we're here to take X-rays, right? And I was like, yes. The sad part is that patient asking for water, that patient asking for this or that, look at what floor we're on. And I'm like, oh, we're in the surgery area. We're in the da. The answer 99% of the time is going to be no. Or, you see how there's an MPO right there? No. And slowly, you'll understand that it takes just a few patients. Like, at the beginning, you'll have like a higher tolerance because you're like, da. And then slowly, you'll start your shift. First patient that comes in, the nurse, like, before you even enter your room, the nurse is going to be like, hey, this patient's a difficult patient. They've been refusing stuff. They've been mean. They give you the whole spiel. You go in straight up already, straight getting disrespected. Either you get the picture or you don't get the picture. And already your level, because every day, all of us, regardless of if you think about it or not, you have a little counter of like how much you care. And it's a little thing, right? Every day it starts out full. And then slowly, as your shift goes on, as your career, it gets like smaller and smaller and smaller. It's a sad truth, because you're dealing with other people's problems so much. It's not that you don't care. It's that you've gotten so used to doing the same thing over and over, and you know what it could be to get this picture and how easy it is to get this picture. And you know, if the quicker you get this picture or the most optimal picture, the doctor can help this patient, right? So like when you get a difficult patient and they're giving you a hard time, and like sometimes it's like you x-ray them and like nothing is broken, and then you're like, are you just being extra because you want extra pain medicine? Because you've seen it, and like you slowly just get corrupted. Like it's the sad truth. Like I remember coming in to my x-ray job first week, especially I work night shift. We wake up, we have to piss off every single person between the hour of 2 a.m. and 5 a.m., right? Because that's my job, doing morning ports. At first, I would walk in and I would see the patient, right? And I'd be like, hey, sorry to bother you. 2 a.m. I'm here to do your chest x-ray, all like soft, gentle, and stuff like that, right? Patient would wake up and like, and like Matt just straight up disrespect you. And I would be like, oh, I'd be apologizing. I'd be like, da. You do that for 4 years straight, and you already know. You walk in, you already know this, like, a majority of the time, the patient's going to be mad at you because you're doing this. There's no other way. Because majority of the times, even me being in the hospital with my family, seeing what they do, the majority of the time, the patient doesn't get any rest. If you know it from that perspective. Because like every hour they're monitoring, every so-and-so, people come in, bother them. So they're not sleeping. You come in, you're just another person to them that's bothering them. And they're going to be mad at you. And now at this point, I've heard it all. You've gotten to the point where you hear everything. Majority of the times, unless the patient has their little water bottle there or the little things of snacks, like literally close to them, if they ask for it, okay, you probably give it to them. If they don't have nothing and they're like, can I have juice? Can I have payment? At first, I was like, okay, well, let me talk to your nurse. Da, 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 da. And the other tech who was with me, veteran tech, been doing the game for like 5 years, he'd be like, let this be a learning experience for you. Go find a nurse. He would wait. And I tell you, 99% of the time, the nurse would be like, who? They can't have water. Or who? They just had payments. You get told no so many times, eventually, majority of the time, you're probably going to be like, okay, I'll ask someone, and then you kind of move on to the next. Especially during morning ports, like we x-ray, because you do so many, and 99% of the time, they'll tell you no. Sometimes you can just kind of gauge the situation on the patient, and you're like, okay, this is a normal patient. He was nice. He let me do it, da da da. I'll go out my way and I'll do something. If the patient already starts off and being mean and being rude to you, majority of the time, you're probably not, because you're like, I'm here to help you and you're being mean to me. That's just part of the thing that happens to you over time. And I know you're probably like, oh, Miguel, nurses aren't like that. My lady is a nurse. After so many times of you trying to help someone and they're being mean to you, or just in general, like you're kind of over it. You're just like, okay, you either want this or you don't. I'm here to help you or you don't let me. Either you don't want this extra or you do want this. Like that's kind of like, it's kind of how it is. Over time, it's sad that it happens, but like that's the sad truth of the field that we work in. And I know over time, certain texts, you're like, oh, Mikhail, so-and-so isn't like that. So-and-so, okay, everyone has either their own level of tolerance, their own level of experiences, because maybe there's certain patients that will come in and you'll see them over and over and over. It's like that broken car that comes into the shop for the same thing. And maybe it's like super hard to fix, or the owner is super like mean. And it amazes me how some patients will come in needing help, they're dying, and they will be mean to you. And I don't know about y'all, but if you see someone or you meet someone and you get disrespected, you'll of course, anyone is fair game. You'll go in there, same level of professionalism. You're like, my name's Miguel. I'm here to do your Xray. Da, 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 da. You explain to them what's going on. Da, 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 da. Get the job done. You go in, same level, do not know this patient, and they come in already disrespecting you, and you're like, I'm going to do this to the best of my capacity, but just know if I see you again, you're probably a little bit different. You're going to be treated a little bit different, but I'm going to just do my best. If you see this person over and over and over, and every single time they're straight mean to you, the doctor, the nurse, like they're just notorious to that. Like, I'm sorry, like you're not, like we're here to help you. Like, it's just stuff that happens over time. And yeah, it's been your boy Miguel. I'm here giving you the knowledge you probably won't hear anywhere. It's just the honest truth. Yeah, it's been your boy Miguel. See you on the next one.